Hey everybody, this is Dr. Ben Kersenbrock. I just thought I'd take a couple of minutes and explain kind of the who, what, why, and where of Graston. So Graston is an assisted soft tissue mobilizing technique. We use it for people who have acute injuries, meaning they're brand new, or injuries that are sort of old and they just can't get rid of them. The way it works is you use tools. There's actually a bunch of different types of tool. I like to use something like this, although these aren't the most expensive brand. It doesn't matter. What you're looking for is something with a nice beveled edge and a really dense material. And what you're doing is using that density of the material to move along the soft tissue of your patient so that you can help identify where there's scar tissue. So scar tissue builds up where there's an old injury. When you injure it initially, you build up inflammation, and over time it settles, and that settling turns into like a fibrotic kind of tissue, and that allows the tension to grow greater in the joint. So instead of moving full range of motion, now you're only moving slightly. That causes all other compensations and problems. So we use Graston as a way to relieve that. So I've got Kath here to help out, and she's going to help me demonstrate. We're going to do a little bit of Graston on her lower back. So the first thing you're doing when you do Graston is you do a proper warm-up. So Kath was out front getting her heart rate up just a little bit. The reason that's important is you need to have blood flowing to the area that you're trying to fix. It just really helps promote what we're trying to do. A light coat of some sort of rub. We're using rock rub here. And the technique is basically working your way, if you don't mind, bend forward just a little more. Working down, sort of like exploratory at first, and you're looking for gristly feelings, and it's very light, almost the same heaviness of if you're shaving. But as I feel down, right in through here, it becomes very gristly, so that's where we're gonna start. So this type of technique actually works pretty quick. A standard appointment in our office lasts about 10 minutes of actual Graston work, but the entire appointment's about 30 minutes, right? So it's about 10 to 15 minutes of a good warm-up, 10 minutes or so of the actual Graston technique, which is what you're watching right now, and then about a 10-minute stretch and ice on the backside. So it shouldn't hurt. Kath, is it painful?
No.
Should just feel as though, really from the patient perspective, like you're not getting much. It's one of those things where, as a clinician, you really feel like, geez, am I doing the right thing? Am I giving enough pressure? Is it doing the job it should do? But Graston has been around for about 20 years. It's been tried and true and studied and proven. And so really what you're doing is just almost using just the weight of the tool itself. Of course, because she's in the position she is in, I can't just use the weight of the tool because of course it would just fall right down. So I have to put some pressure in. And when I'm doing this, I'm trying to hit multiple angles, left, right, up, down, all compass directions to try to hit the scar tissue, because unlike the muscle, which travels straight up and down in this position, right, the erector muscles, the scar tissue is laid down haphazardly. So by using a tool to get into the area, you have to hit all directions to hit as much of that scar tissue as you can. Another thing to make note of if you're having this done or just interested is to pay attention to, can you notice there's like a small bevel here, right? So I'm not using the opposite side because that doesn't match up with her body, right? So if you turn it over, now you're pretty matched up. What you're not trying to do is using a separate tool, right? You're not trying to use something like this where you're really fighting against the angles. You're just really working with the patient and how they move already in the contours. And that little bit of difference makes for a lot more comfort. But you can tell, even if you're just paying it, just noticing this, is that the blood is really coming to the area. And pretty soon we'll get some petechia. There's a couple different ways to do this. You can have the patient laying on her belly and doing it that way, or you can have them stretched out. My thought is that you can become very specific with what tissues you're using, or what tissues you're trying to affect by bending the patient in different ways, right? So we're working the muscles on the right-hand side of her spine. These are erector muscles. When these muscles squeeze, it pulls her upright. So to really put them into tension and expose them the best we can, we want to put her into like a flexed position that stretches those muscles. So there's really nowhere for them to go other than the direction they were meant to. And that means anything going the opposite direction is going to get caught in the Graston tool and get worked out. By the way, the thing we're looking for is called petechia, and it's just starting to come now. This won't happen really well for another 3 or 4 minutes. But what we're looking for is redness to build up in the area, and eventually little red dots. And those little red dots are the things I've referred to a few times already, called petechia. And that petechia is the broken up blood vessels of the scar tissue. And that's what we're gonna try to stretch out and ease with some ice a little bit later. Generally, a patient will feel some soreness because we're really turning old inflammation back into new inflammation, but that's what the ice and the stretching is good for on the backside, is working that out. Hey, we're back. So it's been about 5 minutes of doing Graston long cast lumbar erectors. You start to see that the petechia has popped up where it really was scar tissued up right in there. There's definitely a difference from side to side, right? Another thing to notice if you're checking out her back is check out down here where there's no petechia like there is above, right? What that means is that there's scar tissue here, but not here. So when you're doing this, it really shows the effectiveness of the technique when you hit it into the right area, because when you're in an area where it doesn't work, it's not gonna just show up. So I use this in my office, gosh, just about every day. We're using it for plantar fasciitis, shin splints, golfer's elbow, rotator cuff injuries, old arthroscopic knee problems, even a little bit into the TMJ, certainly whiplash, low back pain like we're doing it for here, all kinds of musculoskeletal issues throughout the body. Fibromyalgia is another good one because it's so gentle. It's a really easy way to work with someone. And after we do the icing and the stretching, we'll also sometimes, or in lieu of, we'll do some cupping in the area because it's a really good adjunctive and complementary service. So this is on the back side. So she just had a 10-minute yoga session where we did down dog, up dog, and a bunch of warrior poses. So now that the muscles are all stretched out, now I'm laying her down just to cool down the area. If you want to see it again, is that okay if I lift up your shoe? You can see definitely a difference from side to side. So because it's all turning back to inflammation, just want to cool it down. I'm okay if she's a little sore for about 24 hours. What I don't want to do is treat her again while she's sore. So I would recommend her to come back in about 2 days or 3 days. And that would be a really good time to do this again.